Two local researchers believe they are on the verge of a medical breakthrough that can help women. Their research project focuses on women getting hysterectomies, hoping to prevent one of the side effects of the procedure.
Hello, this is Lois from the Hysterectomy Project.
Lois Lockhead is a PhD candidate in the UBC Faculty of Medicine, hoping to help Northern BC women. She's been practicing as a physiotherapist in Prince George for 20 years and noticed a common problem.
I would see women who had back pain, and when I was taking their history, it seemed that I had a disproportionate number of women who'd had a hysterectomy.
This ultrasound image shows the pelvic floor and bladder of a woman after a hysterectomy. The procedure is the removal of the uterus and sometimes the ovaries, often done through the abdominal wall. After consulting with others in the field, Lockhead believes there's a link between hysterectomies and subsequent back injury.
They don't cut through the muscle, but they cut through the fascia. And the fascia wraps around your trunk, and it helps the muscles tense up and they swell, and it tightens this fascia to protect your back.
Lockhead and Dr. Leila Zimmer with the UNBC nursing faculty have launched a study into the issue. They'll be using a new technology called rehabilitative ultrasound imaging to look at patients' core and pelvic floor muscles. The patients will be chosen from Northern BC, which has some of the highest rates of hysterectomies in the country.
Compared to, say, Richmond, ours are something in the neighborhood of 650 per 100,000, whereas Richmond is 167 per 100,000.
We're curious as to why that is, but the main thrust of our study, as Lois said, is prevention and finding better ways to care for women who are choosing to have this treatment done.
Aside from back injuries and incontinence, there's a number of side effects that can happen from the procedure. For some, mental or emotional stress, and then there's the post-surgery struggles.
Some of the women I've talked to have described how difficult it is getting in and out of bed, and anyone who's had abdominal surgery can identify with that, I think. Going up and down stairs, and just the fact that after any major surgery, you're tired.
Lockhead and Zimmer hope their study will reduce back injury as a result of the procedure. They're looking for women ages 35 to 55 preparing to have a hysterectomy. If you'd like to participate or want more information, contact Project Coordinator Lois Lockhead. Aileen Machel, CKPG News.